I was first diagnosed 20 years ago after a suicide attempt and was hospitalized for a few days, and a doctor was assigned to me at the hospital. And his first assessment of me was that I had bipolar disorder. And at that time, I was rapid cycling, which I'd be manic, depressed, and was put on many different medications. I was taking Risperdal at that time, Depakote, Effexor. It was kind of a devastating diagnosis. I didn't know anything about it. Hadn't really experienced any kind of mental illness in my life at that point. I was managing to go to work for about a year after the diagnosis, and had to leave work and went on disability.
Was it clear what mood state she was in when she made the suicide attempt? Can we also always assume that people who make a suicide attempt are depressed, or could she have been in some other state?
I think she described herself as depressed at that time and stated that she moved into a rapid cycling phase following that hospitalization, and said that that was kind of her first experience with mania around that time.
I don't know how well I asked the question in our discussion, but I was trying to see if she was aware of the cycling or if it was a surprise to her when somebody pointed it out. And I think she was surprised. I think the idea that she was living with an illness in which she cycles from depression to something quite different, quite activated, was new to her.
So, I mean, it's possible. I've had the experience with at least one or two patients that they come in depressed. Maybe they've made a suicide attempt. You start them on an antidepressant, and lo and behold, and sometimes within hours, they flip and either into hypomania or into frank mania. I don't know if that's a common feature. Have you seen that much on our inpatient unit, Rich?
It does happen, in which patients will present, they will look depressed, and we'll start them on an SSRI. And within a day or two, they do flip, and they're up all night. They have increased goal-directed activity, and it's clear that they are manic at that point.
I think a word that I would use would be feeling shame, that I would have these feelings and couldn't do anything to make myself better or to reach out for help. And sometimes I think to myself, well, do I really need my medication anymore? Maybe everything's okay. I can just stop taking my medication and I'll be fine, but I don't dare.
I would think she must have a kind of courage that maybe we didn't talk that much about.
The word that I would also comes to mind for me and I would use is resilience. And kind of in bipolar, that's what these patients have. It's their ability to bounce back from adversity.